Our peak is about the time the president has been talking about for many other parts of the country, a time to reopen. Georgia hasn't really been part of that conversation. The governor instead telling us that more testing, widespread testing, is really needed before Georgia can make that decision. Joe Hankey explains why that is so critical.
Dr. Harry Hyman is a clinical professor with Georgia State University's School of Public Health. He says expanding testing needs to come before talking about reopening states.
Rather than focusing on that, let's identify what needs to be in place in our state for us to feel comfortable that it is safe and appropriate to make that decision.
Hyman says testing needs to be expanded in previously under-tested communities and amongst the 25% of people the CDC estimates can carry the virus but remain asymptomatic. The Georgia Department of Public Health reports nearly 68,000 tests have been completed statewide.
And they're stuck at about 3,600 per day. I can tell you that if you're living in a low-income urban neighborhood in metro Atlanta, or you're living in a rural area in Georgia, you can't walk someplace to get testing.
Kaiser Family Foundation is ranking states based off of testing per 1,000 people. New York and Louisiana are at the top of the list for the most tests completed. Georgia's neighbors are also faring better than us. Tennessee comes in at 16, Florida at 22, Alabama at 39, followed by the Carolinas, and Georgia ranks 46 with 6.1 tests processed per 1,000 people, compared to the national average of nearly 10 tests. When asked about the ranking, Governor Brian Kemp's staff directed us to his comments on Monday.
Our testing numbers in Georgia continue to lag. As I've said before, the status quo is unacceptable.
On Wednesday, the State Department of Public Health broadened COVID-19 testing guidelines to now allow anyone showing symptoms to be tested. And healthcare workers, first responders, and long-term care facility residents and staff can be tested whether they are showing symptoms or not. A DPH spokeswoman tells 11 Alive the state can currently process around 5,000 tests per day, and there are currently 36 state testing sites with plans to soon add or expand 10 sites based on population.